You guys can get up close, take
Yeah,
a
go
picture
ahead,
if you
take pictures,
like,
but
take a
it's
picture
the
of
exact
this.
same setup as the small valve is
Yep.
just for your
Sorry.
specialty instruments like this.
Shock
That's
to you.
the only difference.
It's exactly the same, the setup.
What are we looking at over here?
These are new specialty set.
That's the Guy's specialty set.
Scutters, Coker
That's the only
Allen.
thing that's different.
I don't know if that's the right angle. Oh, we have a sponge. I don't know if this one is.
No, I think they're cokers.
No,
Cokers.
Coker Allen, right?
No, those are cokers.
And the
Oh.
sharp spot
And
is
then-
different.
Yeah, you guys will get a chance
So,
to look at that.
right
Needle?
angle.
Yeah.
Right angle.
I
I don't know what
just
this one
wanted
is.
you to
Right angle, and I
picture
think this is
of
just a needle holder.
This, oh, a curved needle?
Yeah. Everyone,
Yes, I
a
think so.
picture?
Yeah.
Give you guys
Oh,
like
and then
30 more seconds to take pictures.
There's more shit over here.
If wants to get in here.
Can you borrow
Oh, yeah.
These are from major set. These are the specialty, right?
Yep, because that's a single tooth tenaculum.
Oh.
Tidneck?
I was like, what is this? I've seen this. Single tooth to neck, and then
Tidneck.
to neck.
Hey, Belinda.
I'm being annoying, huh?
Yeah.
Sorry.
Love you. Would you mind moving
Dude,
your hand for
I
a second?
can't open those teeth. What is that,
Thank
a
you.
Coker Allen?
It's a Heaney Valentine.
Heaney Valentine, okay. Single tooth. Okay.
And all the instruments you guys already learned.
Hysterectomy plans, okay.
And then you guys could let the other group go up front closer and take a picture. I think closer, take some. I don't know, do you want to go closer, Zoe? You can go closer. Yeah, so you can see.
Is that a
So everyone
GoPro?
take turns going closer.
Is that a GoPro?
Oh.
Excuse me?
Close to take a picture.
Time out.
Okay, so we timed out, same thing, everything's the same. The procedure is gonna be hysterectomy.
Okay, we doing midline or penisteel?
Let's do Finisteel.
All right.
We didn't draw up local, it's the same thing. Okay, so Finisteel, do you guys know what's a Finisteel incision?
Right here.
Yep, exactly. So we're doing an incision this way, okay? Knife is down, okay. Same thing, going in, the same thing. Take 2 cokers. Normally is this side. Okay, so now we push down. This is okay. Knife is down. Same thing going into the abdomen. Okay. All right, take the O and O.
All right, circulator, can you open the O and O for me? So one of your hold items will be the O and O, that's over there. So go ahead and open that. Just open it like you would if it was a rack, yep. And then I'll come grab it.
Perfect. Go ahead
Can
and
we
pick up
count?
the wrap. Go ahead and pick up the wrap and then check, make sure there's
Yep,
no
so
rip
hold.
holes until, yeah, same thing. And then flip it around, do the same thing, perfect. All right,
All right, circulator, can we count? All right, so just somebody be a circulator.
laps?
No, we're just gonna count this. We already counted everything else. So whenever we bring anything to the field that's counted, we have to count it in. Okay, so the O and O, the way we count this is the O and O itself.
you can see.
There's 1, this wing nut, 2, 3. There's only 3. These 2 come off, and then the whole thing itself, 4, 5, 6. Okay? When we pass this,
Can you show them the set? Can you put all the set on the side?
That's
Yeah.
yeah, it's your
Take a picture.
bladder blades. Okay, now for the O and O, if you notice when we put the Balcor in, we put the Balcor in with the twisty thing down towards the bladder. For this one, we need to put it up this way towards the chest, because if we put our bladder blade on here, we won't be able to adjust it. So it needs to be flipped this way, bladder blade this side, we can adjust from here. Make sense?
Yep. Okay. Alrighty.
You want Lux?
Yeah. right, so it's the same thing. Okay, let's do it like that. All right.
She's gonna dissect down.
Do you guys know what is the first thing that we're looking for to do an open hist? You guys gone through Guide, right?
We
Chapter.
saw
Yeah?
a video of
Okay.
hysterectomy.
So what are some of the structures that we're looking for?
The ovaries, right?
And
Sharp.
The ligaments.
ligaments, okay? What are the ligaments?
The broad ligament and the cardinal ligament?
Around it.
And
And
round.
round ligament.
Yep. Okay, so now this is our pretend. Okay, so just want to let you know this is the ligaments, and I'll attach more yarn. Yeah, so this is going to be your ligament that we're resecting.
Okay, so
Okay.
when we get to the uterus, we need to get control of the uterus. So it's gonna be either your single tooth tenaculum or a long Alice. Okay? Yep.
Oh, good. And sometimes we use the tenaculum because, for example, if there's a tumor or if the tumor is too big, it's hard to get hold of, or there's a lot of inflammation. This is what we hold on to. You have a better grip. Sometimes, depending on the anatomy, sometimes the uterus is very deep, right? So we have to like dig it out a little, okay? All right, so let's say this is a normal looking uterus. All right, we'll go for the ligaments.
So same thing with the ligaments. It's going to be your curved heenies because they're thick. The ligaments are thick.
Yeah? Okay, so ligaments.
All right, so now it's
Here's
gonna,
another one.
same thing, it's like if you're doing any
Double
vessels,
tooth
clamp,
curved.
clamp, cut, tie. Okay? So when
Okay.
we cut ligaments, because they're thick. We're gonna use our curved males to cut those ligaments, okay? Now, with we have what we call pop-offs. Okay, the ligaments are too thick to just take a tie and tie around the whole thing. So what they're gonna do is they're gonna take a suture, a stick tie or a suture on your needle driver, and they're gonna go through it, around it, through it, around it, so it occludes the whole ligament. Okay.
Okay, and you guys notice we will go over individually with you guys, heat
Yeah, how to load
over
it.
how to load this properly. Okay, if you guys want to take a picture right here, go ahead.
Curved heenie.
Good. All right, I'm gonna take a picture. I'm gonna set it right here, and you guys can take a picture. You can probably see that better on a blue. Good. All right, so we're gonna take a stitch around the ligaments, pretty much, and this is called a stick on a tie, meaning there's a needle on the tie. Okay. So, and what we do is after the doc make a stitch, they will pull this needle off because it's a pop-off needle, okay?
Okay, and they'll give you the needle back.
Here's a needle back.
And for this, we're gonna do this a few times, so you guys wanna just automatically load another one.
Okay. Yeah. Suture scissors.
So you have to start loading the needles from that side of the suture pack and then work your way.
Well, I go through, it says 1, 2, 3, 4, 5, 6, 7, 8, so I just go that way, or you can
Yeah.
go.
I'm
whichever
used to
way.
going from 8 to 1
to
because
one.
that's how I count
Oh,
the needles at the end. But it doesn't really matter which way you start because you still have to count all the needles.
okay.
I do it that way just because it's
Yeah.
easier for the nurse to see. Okay, wow, this, let me just protect this needle. This needle driver's loose. Okay, needle down, not protected.
And we would do this 6 times.
Okay. All right, let's say we already did 6, okay?
Now we're gonna do the cuff, the vaginal cuff.
Which is this one right here. Okay.
Okay, so a couple different ways we can, first we need our 2 heenies, heenie valentines. They're gonna go straight across like this, so we can cut in between.
See this? Okay.
Okay, a couple things we can use. We can use the Bovie, or we can use, oh, we don't have a,
We don't, yeah, we need to grab one, another
Yeah.
10 blade.
yeah, you'll have another 10 blade. You use your 10 long if the doc wants that, or you can use your Jorgensen scissors.
And Jorgensen scissors are the most common scissors that I use for the cuff, okay? It's the thickest tissue, also known as the vagina scissors.
Oh, wow.
So you guys can see this.
Scissors.
Good?
Mm-hmm.
Yeah, everyone got a picture? Okay, all right, so we will just make the cut at the cuff, okay? Now, specimen is free and this is dirty because vaginal area, I'm just gonna do that.
Specimen,
Specimen,
what do you like it called?
hist,
How you like it sent?
at the end. So
Okay.
uterus plus bilateral BSO and all that.
You want your close and stitch on Heaney or regular needle cover?
Heaney, please.
You want to just use this one? Or-
Yeah, just use that, yeah. Pick up thick tissue.
Oh yeah, behind these.
The actin, or we have the big tissue. Yep.
Oh yeah.
Okay. So because the vaginal cuff is a very thick tissue, right? So I'll put right here. This is tissue forceps, but extra long.
And they're
Good.
long because we're down in there. It looks very superficial because we're with the dummy, but when
And
you're
this is
in
very
there,
long.
it's deep.
Okay. This is the long one versus the short one. Okay. All right. So we're just gonna
So now,
close
for
the
this,
cuff.
while you're closing the cuff is a cavity. So that means we need to do a soft count. Okay, so unlike the small bowel, we'll do our counts. You got your initial count, you have your intra-op count, and then you have your after-op count. For this one, we have 4 counts. It's gonna be your initial count, your cuff count, which is just soft items. Then your instrument, then your board instrument count, and then another board count. Okay, so 4 counts altogether for this one.
Scissors.
Okay.
Long.
So at this point, once I give her the scissors, we will go ahead and do a board count. Okay, we don't have to do it, but we would do a board count at this point at the cuff.
Okay, so now that the cuff is done, the repair is done, we go back to the same usual routine.
Yep.
You guys know what?
Irrigation.
Irrigation, exactly.
There you go.
Irrigation, test for bubbles, make sure
How
there's
would
no
you like
leak.
to close?
How would you like to close, and so on. So everything else is the same, except the middle part. Also, sometimes the surgeon may ask for a ligature. So it's pretty much a heating burning device that can cut as well. So they may not use as much of sutures.
Yes.
It just really depends on the surgeon's preference,
we'll-
depending on the patient's anatomy.
And we'll add more of this stuff as you guys get more comfortable with this. We'll add a ligature, we'll add
Yeah.
more stuff like that.
Ligature, there's different types, which I'll show you later on once you guys get this part going. Okay, those
Okay,
are all the small items. It's
The
not
ones
very
with all the
important.
pop-offs, a lot of the times they use the pop-offs, but cutting, they have so many different ways to cut and cauterize now that they don't, this is really old school, the way we're showing you guys right now. But we'll start bringing in more stuff that we actually use out there so you guys can see it in here, how it would actually go.
Yeah.
And then Bookwalter, we'll go ahead and open this
Yeah.
real quick.
You guys good on O&O part, the procedure part? Any questions, concerns? Go ahead.
Because it's not a big abdominal case,
Right.
when we do irrigation, are we still gonna say big or small?
Yes.
This could be a
Both.
big abdominal, because
Yeah.
we might use this retractor right here. We could have the patient, it just depends
Yeah,
on. how
it
patient
depends
is.
on the pathology, right?
Yeah.
Sometimes, a couple of weeks ago, I did a tumor that's this size, so
Oh,
Yeah.
we
okay.
have to use that,
That
right?
makes
So it just really depends on the anatomy, but right now, we're sticking with the basics so that you know the basics of how to do a hysterectomy, okay? Questions?
Oh yeah, is it the same dressings they're using?
Yep.
Everything is the same.
Oh, okay.
Like literally, the whole entire procedure is
What?
procedure part's not the same, and that's set up.
And we're-
Everything else is the same concept, same steps as a small bowel
And
resection.
any other belly case you do.
It's
will
all
be
the same.
Just like this, except for different specialties.
Procedure,
Yeah.
specialties, what we're doing. Go ahead.
And from now on, we're gonna do cord management on all of our cases.
Everything.
Yes.
Yep. Mm-hmm. guys know? Good?
Can
Everyone?
I get more clarification on the count again? So we're gonna do
Yeah.
one.
So just remember, like the small bowel, you know when to do your small bowel counts. You're gonna add one more, the cup count. So whenever your doc cuts that vaginal cuff,
Okay.
give stitches, whatever they need, I need to do a soft count.
Okay.
And then after that, it goes back to when closing the belly, you start your board instrument count, and then
Skin is gonna be soft again.
your last
Yeah.
one.
So for hysterectomy, guys, just to reiterate that, how many soft counts do you do?
That's gonna one, technically three.
Yeah.
Yeah.
One in the beginning, one at the cuff, and then
Your last one.
last one. Yeah. Oh no, two. Sorry,
yeah,
not
you-
four. Sorry, four. Yep.
What did you
Makes
say
sense.
when you grabbed the
So-
O&O?
So, when I got the O&O?
Yeah, you did another count?
It's
Yeah.
instruments, because we're adding
it's
instruments.
just like the valve for, once we open it, we get ready to take it over there, I'll show you guys.
Yeah.
We have to count this too. We
Okay.
count everything, and we're just counting it in, like if, I was to need another kind of GYN set, something more extravagant, I would ask the circulator, hey, I need this GYN set. They would bring it in, I would have to count everything in there, just like we did our count for those instruments.
And just like
Because
softs
everything has to
too.
be
Yeah,
counted,
like
yes.
anything intra-op, you have to add it in as a count, right?
Yes.
Intra-op count.
We wanna keep track
Adding
of everything
instruments.
we have.
Who knows? Maybe we might get into the biliary system. You might have to add another complex general, right? It depends on the case, right? But this is just like the most basic
Yeah,
standard.
and you guys start thinking
hysterectomy.
more like that, like what we're getting into now, a lot of these cases could go a lot of different ways.
Yeah.
Like Sherry said, you know what I mean? One simple exploratory laparotomy could turn into, like Sherry said, oh, I need biliary instruments, I need thoracic instruments,
Or
whatever.
maybe you hit the
know.
aorta, you need vascular instruments.
Yeah.
So it can build from here. Okay, but this is like the basics. Okay.
Alright.
Alright, let's do bookie.
One more behind you.
Real.
Oh, sorry, go
Okay,
ahead.
So with the bookie, what you were saying,
Yes,
is it the circulator's job to have that
Correct.
opened for you?
Correct.
Well, can I
because-
open it?
No, I'm just,
Yeah,
I'm just.
yeah.
I'm just saying,
Yeah.
think about it.
Yeah, that's true.
So circulator will have a role and we're gonna introduce that next week.
Yeah.
This week you guys just stick with this and then next week we'll start circulate. It's a lot. I mean, it's different, but it's something that you guys are already doing, right? From the first quarter, so. Alright, let's go
So
ahead and open
circulator,
that.
go ahead and open that for me.
Anyone volunteer to be circulator, please? Yeah, just like how you open
Yeah.
any envelope. Okay.
Alright, so, I wouldn't leave this here, I don't have another table to put this on, I could put it on my basin, I guess, but for now, we would have another little table or bigger table to fit the Bookwalter, because once I pick this tray up, the circulator needs to check our Kim guard to make sure I have no holes in there, so we'll go ahead and do that.
Okay, go ahead and check the Kim guard. Yeah, and then
You
go
have to
ahead.
like rotate it around.
Yeah,
make
and you
sure
gotta
there's
have
no
to
holes
listen,
in it.
here, can I show you guys real quick? Sorry,
Yeah,
just
there you
borrow
go.
this. So
There
when
you
you're
go.
checking a Kim guard for a wrap, you guys, yes, it's huge, this is actually for I think I grabbed this from a robot, wrapper, but, so when you hold it up, right, you gotta make sure you're in the light. You gotta make sure you're underneath here, looking, making sure there's no holes, cause this is the only way that you can see, okay? You gotta do this, but make sure you gotta be away from the sterile field, okay?
If you can spread that out, Sherry. And so I'll act like this was we have a 3/4 sheet. Can you grab one?
Oh, yeah, you want me to add?
Yeah, you
Oh,
can
you want
just
to
go
grab
ahead and
it?
grab one.
Let me
Yeah,
grab
I can set this here.
one. Let me just put this here.
And so for the Bookwalter, soon as Sherry gets my table covered, I would count every piece in there. This Bookwalter is probably an eighth of what we actually have in there, because I think ours is a total of 44 pieces for our Bookwalter. And all of it gets counted. And it's a pain,
Alright.
especially if you're in a hurry to try to count this in and all that, so.
That is one way of doing it. You can just stack things up and start counting. So I want to show you guys, this is a half sheet, okay? or half sheet, or half drape, or 3/4 drape. There's multiple names to it, but it's a half sheet. Okay. What you'll do is circulator will give you this. Then you will set this here. Let me put it in the middle. So you will set this down right in the middle. Right. It just kind of open the same way. Then, because you're sterile, you cannot be opening the flap from here. If you're not sterile, if it's a circulator, they can go come up this way, okay? But for the test, we want you guys to do it,
Yeah.
okay?
So
So you will come to
circulator
the
will be
side
doing-
because this is what? Sterile, right? Then you would just open from inside and open it up, okay? Then you will go on the other side and do the same. Does that make sense?
Okay,
If it was this, oh, sorry, go ahead.
and that's pretty much how we drape
That's it.
any table. Whether it's a long table, short table, square table.
Or if you're draping on top of the patient, for example, you need to fix or something got contaminated, this is the same way. That's just in general how you drape anything.
Okay.
Okay.
So the circulator goes and gets it and
You guys
sets it
will
up.
have it on hold.
Oh,
Yeah,
Yeah,
it
it will
will
be
have
part of
it
your
on
hold
hold.
items.
Oh,
You guys are gonna have a lot of hold items, and it's for this particular test, it's all about teamwork, right? So in the OR, you have to work with your circulator, whether you like the person or not, right? So you have to work together, and so you guys have to communicate. So this is the part that when you get into the program where you have to communicate in the OR, okay? Because you guys are both getting tested.
Alright, so my circulator, who's my circulator?
Whoever, doesn't matter. Anyone.
Alright, pieces 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17.
Okay. And also, I do want to
I'm
point
messing
out
up
too,
my
this
Oh, we
is
had
one
18.
way of counting. Some facilities, they
Right.
count this separate, okay? So the post is 3 pieces.
Yep.
Okay, 3 pieces.
And different facilities have different ways they have this.
1 ring, this is a ring, right? And then the blades, 1, 2, 3, 4 blades. And then the clips,
ratchet.
the ratchets, 1, 2, 3, 4, 5, 6, 7, 8.
So we don't need to count it with suture scissors like our last one?
You do, you do.
Yeah, you should.
You should.
You should,
Everything
yeah.
should be a pointer. We're
Okay.
just showing you what to count.
Okay.
So, so that you guys
Okay,
know.
so on the count sheet, I don't think we don't have a thing for the Bookwalter, so what, they usually do is write it down, 3 posts, your, blades, your ring, and your ratchets. Okay, all get counted separate. Depending on where you're at, we count all of ours together, there's 44 pieces, we count it all together. So it just depends on your facility.
Yeah.
Okay, first piece you wanna give to the doctor. You're gonna have your piece that attaches to the bed, and then your little, thing that holds your ring.
Okay.
Your side, my side?
My side. So you guys, this thing, this is how it
All the way open.
opens
Yeah.
and closes. Okay? Can you guys see on this side? Open and closes. Once you play with it, you'll know what I'm saying.
And you can have it all the way open for your doc, but
So-
they'll put it on and all
Yeah,
that.
this part, this is not sterile, right? The rail, right, on the bed is not sterile. So only this part's sterile, so you gotta make sure everything's controlled. Sometimes, because of arm boards and stuff, some surgeons will have difficulty putting this on, and the nurse will come help underneath the drape. Okay? So, I put this on. Oh, that's too far. And also putting this on, you wanna make sure that the rail has a break on here, right? With the headpiece, the middle part, and the legs. You wanna make sure it's not on the empty area, because otherwise it's gonna fall on your feet. Does that make sense?
Yeah.
Okay, it has to be on a rail, otherwise it won't stay. Okay. And some surgeons, they want you to put this part together and hand it to me, okay? You just gently tighten this, okay? Not all the way locked, so that you can adjust the ring, okay? The ring sits
Regular
in,
ratchet or the
the,
angle ratchet?
the angles.
How many?
This is how, this is how you close this gap right here to hold the ring, okay? Can you guys see? You guys in the back wanna come closer? so that other people can see. Or you guys can take turns swapping so they can see. Okay, so we're gonna put this up here, then this is how you tighten it. Okay, after this is kind of in place, then they will tighten this to make sure this does not move.
We'll probably have to adjust the height.
Okay, does that make sense? Okay,
Yeah.
so, here I can just do that.
Yeah.
Because this is in a weird angle for this.
When you handed her those little pieces, you said angled or.
Yeah, so some of them, I was gonna show you guys, some of these, when you push the button, they'll angle to go like this. These are just straight across. So there's some angled ones are a little bigger, but the docs like those because they can adjust them.
Yeah, and I'll show you guys
Push
once
this
I
side,
put it
yeah,
on.
once she gets it on. Now, when you put these on, you wanna go rivets towards this. Okay? So you wanna put it on like, so you can hear the clicks. And the docs usually like you to have these on there already when you pass them whatever retractors they're gonna use. And there's a bunch of different blades. There's just retractors, just like your ones in your major set. They're just made to be held with this retractor. So there's Devers, there's Sweethearts, there's Malleables, there's Riches.
There's
So
bladder
if you're
blade.
working with your Balfour and they ask you for a Rich, you're gonna give them a Rich that fits the Balfour, not one of the ones out of your pants.
So a lot of times when they're going back and forth, they will call those instruments handheld malleables, handheld riches, handheld sweetheart. Does that make sense? It's handheld. Okay, this is the one that goes on clip on. So going back to this clip, most surgeons, like T said, they like to use this because this articulates. It helps you have a better angle when you do certain cases. It retracts deeper. Okay, all right. So a lot of times surgeons will ask for, I'll take some wet laps, please. They like to use laps so it can protect the abdominal wall. Okay, there's also, later on, we will show you guys other supplies that you can put in prior to putting this on. It will just, it's called a abdominal wall protector. It protects the wall inside so we don't rip anything, okay?
Can it be used with the midline and the finished
Yes,
Okay.
yep, it can. There's smaller versions of the ring, so this is just what we have at the
Yeah.
school.
There's oval,
So
there's round.
there's oval, there's a big
Round.
one, there's a small one. So let's say we're gonna use this. Okay, so this part goes in. This little thing, it slides onto here, okay? Then it goes like this. Okay, and then you can articulate and stuff, but this is too short. I'll just, I'll use this. Same thing, you slide on, then you can angle and push back. Does that make sense? This is just at a weird angle. This guy, you can bend this. Oh no, I bent it too hard. Okay, so you can do that. You can do this way. And this would be down here, and does that make sense?
Yeah.
Yeah, so you can do here, you can do multiple, you can do on top. It just depends on what you're retracting, right?
So they'll use something
Depending on
like
the
this
case.
when they need maximum exposure to
Yeah,
stuff.
or if you have a patient that's, high BMI, then you really need some retracting, right? Because otherwise you don't have enough hands to do so, or, retractors to do so. Okay, so now that we're in, same thing, I can do the procedure this way. Just remember, you add the count, and then at the end, you'll have to count.
Count it in your
Yeah.
final count.
And I think just to, not have any confusion, just count it separately, just so
Yeah.
that they write it down.
Yeah,
Post,
yeah, that's what I'm saying.
yeah.
Write it down.
Post, ring, blades are together, and ratchets. Okay, and then we can maybe ask Chris to make a count sheet.
Yeah.
Maybe
yeah.
he already has. I just grabbed the pen.
Yeah,
So
yeah.
maybe I'll ask. Does that make sense? Sometimes I can ask for the regular ratchets too. So T, can you put one on and I'll show them?
Oh, yeah.
Yeah. Here, do you want to use this? Is that harder?
I got it.
Okay.
I just use this one.
So when you put the ratchet on correctly, it will click. That sound. Okay, so this is just rigid, so it doesn't go anywhere. See, it's so rigid. I'm at an angle, it won't work. Oh, there you go. Good? Any questions? You guys want to get up close and take a picture of this?
Yeah, get up there and
Here,
mess with it.
here. Let me step aside. Go ahead. Yeah, so that everyone in the back can see it too.
Get in there.
So either you could ask for a Bookwalter or a O&O.
Yep. Mm-hmm.
Or a Balfour.
Or about for Or I may not use anything. It depends on.
Yeah, as we go, there's more stuff that we're
Yeah.
gonna show you guys for retracting for belly
I just wanna see how
cases.
this looks.
There's probably
Oh, it's
6
just
or
on
7.
That one
different
is not,
things you
'cause
could
the
ask you
angle's
guys
not all the way
for
on.
your next
Yeah.
step As far as what we do for
Alright.
retracting.
Okay.
MJ and Millen, you guys wanna see, can you guys like swap back, let other people come forward? Thank you.
Well, if I'm in a hurry, I'll
Yeah.
count them as I'm passing them to the surgeon, so I would
Good.
get
You guys
in my
saw the
post
picture?
first.
Good.
So I'd
Okay.
say post 1, 2, 3, I'd go over here, do this, come back, grab my, ring 1. So if you're in a hurry, the doc knows you need to count,
Okay.
but I would still count as I'm passing that to the doc. Or if I'm in even more of a hurry, I'll just count it after they get it set up.
Yeah. But right now, you guys are not gonna worry about that,
Yeah.
because we're not doing that part yet. That is later down in the different quarter. When you have to work under pressure, okay? Not particular for this, we're not gonna push that much, because you guys are just learning the retractors. But later on, we will, like your work under pressure and being timed, because you need to get this going. Because if the patient's bleeding out and you can't see, patient is gonna bleed out, right? So we gotta make sure there's a certain amount later on in the different quarter.
Just make sure you count it
we
when you
count
bring
everything.
it in and make it part of your final count.
Yeah, and we'll get to that. So right now, just focus on this. Don't worry about that part yet. But later on, you guys will do a case from something converting to open. So, okay. All right. So, any questions? Good.
Are we doing our local still? Like setting it up?
Everything is the same. I just
Everything is
didn't
the
do
same.
it just because I want to hurry up and get it going. So, everything else, the setup is the same except that specialty. Procedure is different, and then depending on what we add. And then I'll get all the literature probably next week. That way you guys can get started with this. Good? Okay.
Yeah.
All right. Same groups as yesterday. Allison, can you please still be the charge? And next week we'll go back to the rotation. So if you want, you guys can just kind of work off this and start. So we only have one bookie, so everyone has to take turns using it. Okay. O&O, there's another one, right?
I think there's
Yeah.
an O&O for
We'll
that
set
side.
up another one over
But
there.
usually if you don't have the Bookwalter, you're gonna use another different type of retract.
Yeah. Okay. But everyone needs to get used to that. Okay. All right. You guys are free to get in your groups, and maybe whoever's starting here can just clean up, and then